Let's begin this discussion now. The High Court in Johannesburg has ordered the Gauteng Health Department to take all necessary steps to provide radiation oncology services to patients at Charlotte Maxeke Academic Hospital and Steve Biko Academic Hospital. The court has found that the department's failure to implement a plan to offer these services was unlawful and unconstitutional. Now, Section 27's head of health rights, Kanisa Mapipa, joins us now for more on this discussion. Kanisa, thanks very much indeed for your time. And I mean, when we talk about the court ordering the department to do everything it can, all in its power to address the backlog in radiation oncology, there was hundreds of millions of rand that was not used by Gauteng health officials allocated in March of 2023 to do just that, to address this backlog in radiation and surgical procedures.
Exactly. Firstly, thank you for having us. So the money was allocated back in 2023, in March 2023. And at that point, one would have expected the department to do exactly that, all that it could possibly do to take all the necessary steps in order to ensure that these services were provided. And this money was allocated in 3 tranches from 2023. The initial amount was 250 million, and we know that the Gauteng Treasury expected that money to have been used within that financial year. At the end of that financial year, because the money went unspent, the money was then taken back by Gauteng Treasury. The department at that point failed to go out on any type of emergency procurement program in order for it to be able to procure these services through an outsourcing mechanism or even through a private-public partnership. And in the meantime, cost thousands of people reoccurrence of their cancer and even possibly their lives.
Absolutely. I mean, when we talk about sending money back to Treasury, that could be used on things like service delivery, providing water, electricity, infrastructure. You know, that's one thing, and it comes with its own host of challenges, and some of them are life-threatening. But sending money back from a department that so desperately needs it for something like cancer treatment, where timing is everything, it means that the people who are last on the list are literally dying.
Exactly. That's precisely it. I mean, today we celebrate because the court has now declared this conduct unconstitutional. But that means very little to the thousands of people who've had to endure time and time again, chemotherapy, surgery, as their cancer reoccurs. We know that the Department of Health has been less than frank with the public in terms of what it is doing to try and address these the lack of services in terms of radiation oncology treatment. Last year, we had a campaign as Section 27 and Cancer Alliance where we sought answers from the department around what it was doing to utilize this money to assist those who are desperate and in need. And in that time, the department responded to say that it was using the money to buy machinery and to update its machinery to build bunkers and the like. And that now has transpired to not be entirely true. And so one of the things that the court has been quite displeased about in the judgment has been this issue of the Department of Health not taking accountability and also not taking the public into its confidence regarding what is happening within the department, what the delays are, and also leaving cancer patients to worry about whether or not they're going to receive treatment as their disease progresses and as their families are affected by this issue.
It's devastating. And I would go so far as to say that these officials have blood on their hands, Kanisa. And I just want to read part of what the judge had to say in this decision. He says backlog list patients have already passed away, waiting for such treatment that has not been forthcoming. Actual irreparable harm has already occurred, continues to occur, and is reasonably apprehended. The provincial health respondents, however, ignore this.
Quite right. We know that in September of 2024, the department went out on an emergency procurement through Treasury Regulation 16A6, where it sought to outsource these services on an urgent basis. So we know that part of that has been successful in Pretoria through Steve Biko, but we don't know if that similar arrangement has been made for Charlotte Maxeke. The last we knew was that these outsourcing arrangements had been, the service level agreement had yet to be signed by the CEO of Charlotte Maxeke. So what we know is that this was always possible. If it could have been done in September 2024, then it could have been done a year earlier, a year and 6 months earlier in March 2023. And the department has yet to account for why there has been this delay of over 2 years since the money has been allocated in order for them to do something that is within their own procurement guidelines, that is permissible within their procurement guidelines. The other thing that the court says in the judgment is that there is no response from the department as to why it hesitated to take the guidance provided by Gauteng, by the National Health Department on this matter, as the National Health Department also gave guidance on how it did emergency procurement during COVID-19. And so the court says, it leaves a question mark in everyone's mind as to why the department did not take into consideration the guidance that was provided by the National Health Department in how to procure for these services in an emergency procurement, but also in line with the procurement guidelines.
Yeah. I mean, ultimately what we need, and I think one of the applicants in this case has said as much, cancer care in South Africa needs a complete overhaul because there's such a huge disparity between public and private healthcare insofar as cancer treatment is concerned. 86% of the population relying on 20% of cancer care services. So basically, the bulk of the population relying on public health facilities for the cancer care that they receive. Is that right? Kanisa, we are running out of time just a little bit. Can you answer this quite well, as quickly as you can, and then also just give us a sense of where we are at with the backlog and how we keep the department accountable for this decision in court?
Well, we now have a great mechanism through this judgment. The judge actually ordered the department to provide an updated waiting list or backlog list within 45 days to the court, and then also directed that they provide a report that details its plans on how it plans to deal with radiation oncology in the province, and also particularly with the backlog list. And so we as Section 27 and Cancer Alliance will be monitoring that quite closely to ensure that the department now complies with this order through the court, and also that they can be held accountable if they do not comply.
It is quite literally a matter of life and death. Kanisa Mapipa, let me thank you for your time. She is a Health Rights Program Director at Section 27.